Now we are looking at the most inferior part of the sternum, which is called the xiphoid process. It is the smallest part and has a tip pointing downwards, located at the level of T10 vertebrae. It may have different shapes and sizes in different people. You can also come across a lot of variations such as bifid, which means having two heads, and even a perforated xiphoid. As you can see here, it could also articulate with the part of the costal cartilage of the seventh rib. Initially, it's cartilaginous and its upper end gets ossified in the adulthood around the age of 40 years. It mainly provides attachments to several abdominal muscles and ligaments, which provide support to the abdominal wall. We'll learn all of these properly in the next section.